Hello, my name is Judy Mashira. I'm going to be recording a comprehensive assessment for NU650 for Regis College. This is my patient, Samuel Kirwa. Do you give us permission to record this video?
Yes, I do.
The first thing I'm going to do is to show my equipment, my otoscope, my thermoscope, my spoon, my reflex hammer, and my sharp and dull equipment. I'm also going to show a 360 my environment. It's my house. Okay, thank you. So you're going to start with assessing the head. You're going to look at the skull for any deformities. It's asymmetrical. We're looking at the scalp, looking for any rashes, masses, any lesions, any open skin. There is none found. We're going to look at the distribution of the hair. It's even according to his gender and age. He's a 47-year-old male. There's a little bit of hair loss here, which is genetical. It's warm. There's no drainage anywhere. So we move on to the face. We are looking at the skin, the temperature. There are no rashes, no lesions, no deformity. And moving on, we're going to go to the eyebrows. They are symmetrical to the face. The hair is well distributed. There is no rashes, there is no masses, no lesions. And we go to the eyebrow and the eyelashes. The eyelashes are growing healthy. And as we move on to the external eye, we're looking for the periorbital. There is no edema, there is no drainage, there is no crusting around the eye. The sclera is within normal color. The pupils and the iris are in place, and there's no deformity there. Next, we're going to look at the light reflex and the red reflex, which will be assessed with a dimmed room, which you cannot do right now. When we're going to assess the inner eye, you're looking for at the retina, making sure that we can see all the veins, the artery, the veins, and the macula and fovea, which we can assess they are in place. The next test we're going to check is cranial number 2, which is the vision. Using the Snellen card, we're going to ask him to read the smallest from about 14 inches away. So can you read the smallest that you can see from that angle?
I can see 428365 WEMOXO63.
Okay. So his vision per the Snellen card is 20/40, and he wears corrective lenses. So for the eyes, we are going to move on to the nose. We're looking at the external nose. We're looking for any rashes, any lesions, any deformity on the nose. There is none that is found. It is healthy. We're going to look at the internal structure of the nose to look for any drainage, discharge, or swelling. We're using the otoscope. Alright. So the septum is in place. It's well vascularized. It's intact. There's no drainage, there's no swelling, there's no foreign bodies in there. So I'm going to ask you to close your eyes, and you're going to check the smelling test. That is cranial number 1. Tell me what you smell.
It's an orange.
It's an orange. You're correct. So he's passed his smelling test. We're going to close one ear. We're going to check the patency. Close one and breathe in with the other. Do that for the opposite one. And that is intact. And we're going to move on to the mouth. We are looking at the lips. They are moist. They are healthy. There are no crusting or open areas. There's no lesions. they are well aligned to the structure of the face. Then we're going to look at the internal structure of the mouth. Open up for me. You're looking at the buccal mucosa. It's pink and moist. Stick out the tongue. Say ah.
Ah.
So we're checking for the gag reflex. That's cranial number 9 and 10, and it's intact. So let's see the below tongue. Stick your tongue out, and that's cranial number 12, and it's intact. So the next thing we're going to check is the facial cranial number 5. You're going to frown your face, squint it, smile, puff your cheeks. Good. So he has a history of Bell's palsy, and we understand the deficits that are there in cranial number 5 and cranial number 7. For sensation, you're going to use this dull and sharp. Close your eyes. Tell me if it's sharp or dull.
Sharp. Dull. Dull. Dull.
So
Sharp. Sharp. Dull. Dull. Dull.
So we have seen that there's a little bit of deficits on the sensation and the movement of the face, so that is expected with the Bell's palsy. We're going to check your extraocular eye movement, which is cranial number 3, 4, and 6. So without lifting or moving your head, follow this finger. So his extraocular eye movements are intact. We're going to check convergence. So look at this finger and follow it without moving your head. There is convergence, it's intact. We're going to check the reaction to light of the pupil. Close this eye, open your eye. And then, so we have equal convergence and consensual and direct pupillary light reaction. He also has equal, the pupils are round, equal, and to light and accommodation. The next thing we're going to check is the ear. We're going to assess the auricle, the external ear. It's intact, there's no deformity, it's firm on both sides. There's no deformity, lesions, or masses. Then we're going to assess the internal ear using the otoscope. You can see the tympanic membrane, it's intact, and the 3 bones of the ear. The ears are clean, very small amount of cerament can be noted. And that's the same here. Nice ear canal, no drainage, no swelling, no redness, and no foreign objects in there. The next thing we're going to do is to test the hearing test. I'm going to ask you to close that ear, and I'm going to whisper something to this ear, and you're going to tell me what I said.
1, 2, 3.
Close this ear.
ABC.
Perfect. So his hearing is intact, and that's the cranial number. The hearing. So we have tested that it's intact. All right. We will go to assessing the. Move forward. At me. We're gonna start assessing the lymph nodes. It's okay. You can put your head up. We're gonna start with the pre-auricular lymph nodes, post-auricular, feeling for any swelling, submandibular, submental, the cervical, posterior cervical, and anterior cervical, posterior cervical, occipital, preclavicular, and postclavicular nodes, and there is no swelling noted there. We also could check the axillary nodes here, which are signs of infections. There is none noted, and the trochlear node. The next thing we're going to check is cranial number 11. So I'm going to ask you to shrug, and I'm going to press down, resist, and that's intact. The next thing we check is the neck joint. We're starting by inspecting the neck, looking for any lesion, any masses, any swelling. Alignment to the head, it's intact. making sure that the trachea, the thyroid is in place and it's intact. Can you swallow for me? There is movement and it's intact. The trachea is in place. We're gonna check his extension, range of motion of the neck. So I'm gonna ask you to put your ear to your shoulder and do that in the opposite. Chin to the chest and backwards. Good. So I'm gonna ask you to resist my hand. Good. Resist my hand. So the neck joints are intact. So you can remove your shirt at this point for further inspection. So we're going to move on to the posterior thorax. We are assessing the developmental for his age and gender, which is exact on the back. There are no lesions that can be seen, no discoloration, no deformity or atrophy that's noted. It's intact. On palpation, it's warm, the temperature is warm, the muscles are well developed. We are also looking for pulsation or heaving. At this point, we cannot see anything. The next thing we're going to do as we assess the cardiovascular, we're going to start with the carotid pulses. Gonna check for bruit. None can be noted. And we'll go on and assess the heart sounds, starting with the pulmonic. So it's on the second intercostal space on the left, pulmonic. Actually, it's the aortic and pulmonic. The heart sounds are strong. Erb's point. Tricuspid. And the mitral, which is a point of maximum impact. His heart sounds are normal. There is no extra beat noted. There is no arrhythmia or murmurs. The next thing we're going to do is to do the lung sounds on all the landmarks. I'm going to ask you to breathe in and out. Take a deep breath. In and out. On the right lower lobe. Alright. There are no rails, there's no wheezing, there's no rhonchi or crackles noted. I'm going to check the posterior thorax, so you can turn and face that side. Good, we're inspecting it for any abnormalities. There is no rashes, there's no open skin, there's no deformities or atrophy noted. I'm going to palpate. For crepitus, say air.
Air.
E.
E.
There's no fremitus. Then we're going to auscultate on all the lung landmarks. Take a deep breath. Again. 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 Good. Alright, that's good. So you're gonna turn around. Going down, you're gonna lie down and put your head on the pillow and bend your knees over here. No, just take it. No, don't wear it. I'm gonna upset.
It's cold.
So the next assessment is the abdomen. We're going to be inspecting. You're looking for any contours or heaves or pulsations that are abnormal. It's intact. Temperature is warm. Then we're going to auscultate the vowel sounds on all the 4 quadrants. just normal breathing. So he has normal and normal active and audible sounds. At this point, we could also listen to the iliac, renal, and femoral veins on the abdomen for any bruise. And none is noted. His abdomen looks okay. We're going to palpate. That's good. So you can, at this point, we could also palpate the inguinal nodes for swelling or abnormality, and none is noted. You can sit up for me. So at this point we're going to check your shoulder joints. I'm gonna ask you to lift your hands out. You can move them in circles, lift them up, bring them forward, bring them across your face. You're checking for one hand at a time across your face, like this, and like this, and the other one, and the other arm. You're looking for extension, flexion, internal rotation, external rotation. You can try to put your hand back like this. Perfect. So he has full range of motions on the shoulder joint. There is no abnormality. His muscles are well developed. There is no atrophy, no deformity, and no lesions or lumps noted. So we're going to go down the arm. First of all, we're going to check the brachial pulse. And it's strong. We're going to check the radio, and it's bounding and strong. And we're going to check his tendons, his reflexes. We're going to start with the brachial. Good. And we're going to check the triceps. Okay. You can relax your arm. Perfect. He has good reflexes. He's strong. So let's check your wrist joints. You can move up and down, inside, abduction, extension, up and down. His fingers, spread them out. Don't let me push them back. They're all strong. Okay, so his upper extremities are healthy, no deformities or abnormalities found. His reflexes are okay. So we are going to move on to the lower extremities. So his lower extremities, we are going to be checking the temperature, the hair distribution, the pulses, and the range of motion. So they are well developed. There is no venous stasis, there is no edema, the temperature is warm, and the hair is well distributed. We're going to check the knee joint. Can flex and extend, can adapt inside, go in, just relax it. It goes out and in, full range of motion, up and down, inside and out. We're going to check the popliteal pulses, dorsalis pedis, and popliteal on the back right there. And we're going to check the reflexes and relax your leg. Relax your leg. Look, hang it. He has good reflexes. We're going to check the knee, and ankle reflexes, which are intact. And then we're gonna do the hip range of motions, the hip joint. So we're gonna lift your leg up, out and in, up and down, both legs up and down, abduction, and he has full range of motion. So we're gonna ask you to turn towards that side. We're gonna check the diaphragmatic excursion. Take a deep breath. It's intact. Then we're gonna check the CVA, costovertebral angle, for any kidney pain. So I'm gonna hit. Do you have any pain?
No.
Okay, good. So at this point, I'm gonna ask you to stand up and take a few steps towards me. Move back a little bit. Take a few steps towards me. We're looking for his gait is intact. All right. You can do a hop in place, a little hopping, up and down. Okay. Knee bend. And take 1 or 2 steps towards me. Yes, full range of motion and back. All right. Then bend touch your toes. Good. Stand up and bend all the way back as you can. You're checking the spinal movement. All right, good enough. Stop. Then move side to side. Again. All right, as you bend, again, one time we'll check. One more time, we'll check your spinal process. All right, and then you can sit down. Checking for clubbing on the knee, on the nails, and capillary refill, which is intact. There's no clubbing, meaning he has no cyanosis or any respiratory issues. His AP diameter is intact. So at this point, I believe that his physical is well done and he's healthy. The plan would be to schedule an annual physical for 1 year after, and also advise the patient to call their primary care doctor if they have any new and concerning symptoms. Thank you.